Hi, I'm Dr. Morgan. I'm a family nurse practitioner. Welcome to Health Talk. Today, I have a very lovely guest, Dr. Kimone Reid. This lady is very scarce, and a lot of people probably wondering, where is Kimone Reid? Here she is, Dr. Reid. Can you tell us a little bit about yourself?
Thank you so much for having me, Dr. Morgan. It is definitely a pleasure to be with you. I've known you for so many years, and as you know, I'm very impressed with you, and you have been integral in my own training as a nurse in Jamaica. So first and foremost, I am also a nurse practitioner, similar to you are, and I am doctorally prepared. So what does that mean? I'm a registered nurse first and foremost, and I've gone on to attain advanced skills and training, which has prepared me to care for patients in a hospital setting. So that altogether makes me a hospitalist nurse practitioner. And more we're seeing nurse practitioners in the hospital taking care of patients. So oftentimes, not only will you see a medical doctor when you come into the hospital, but you'll also see nurse practitioners caring for you. And we are happy to do that, to be a part of your care.
Okay, thank you so much. So Dr. Reid was also trained at the University Hospital of the West Indies. And last week was Nursing Week, right? Nurses Week. And I was trying to get you on at that time, but that didn't work out. So nursing is coming from the days of Florence Nightingale, Mary Seacole, when they were nursing patients with fresh air and warm rug on the forehead. And now we have advanced to specialist nurses and Doctorate of Nursing Practice, PhD, and you just explained your role in the clinical setting. And back in Jamaica, we used to wear our little hats. Do you have a hat?
Oh, yes. Yes. The emergency room at my job with previously gifted me one. I'm very grateful to them. They were so thoughtful. So as a student nurse in Jamaica and as a nurse in Jamaica, I wore one of these hats, and it definitely brought back many memories with my candy stripe and my hat to go into school. Yes, you have definitely brought up fond memories. Being trained in Jamaica, where I couldn't have asked for a better upbringing as a nurse and a strong foundation.
That's awesome. What has your journey been like as an advanced nurse? Tell us from where your journey started to the different degrees that you have done to bring you to where you are today.
Thank you. That's a great question. If you ask my mother, Clover, she would say it has been sleepless, tiresome nights. She has been a witness to the journey. If you ask one of my patients who I cared for last week, he would say, Kimone, I appreciate all that you have done. I cannot imagine how much training and education you have endured coming from Jamaica to get to this point to care for me. And that touched my heart to see a patient could understand the immigrant journey, being here to care for him. First and foremost, I said, I'm Jamaican, and I began my training at the certificate level in nursing, and now practicing at the advanced level with a Doctorate of Nursing Practice. So how did I get there? So I started, yes, with the certificate. And while at University Hospital of the West Indies, I was able to be exposed to so many opportunities. I attained a certificate in nursing management, a certificate in what we call progressive care here, or step down. And I also did ICU. I began in the emergency room right there, and yet I was able to advance and get all these opportunities. And then I thought, I need to progress some more. I have all these opportunities. I want to learn more. I want to be an educator in the future. I want to do research. I wanted to do everything. Everybody who knows me will know that so much of nursing is important to me, advancing the profession, the science of nursing, and ensuring that the quality of patient care is optimal. And we must do well at whatever we do as nurses. That is how we were trained in Jamaica, right? Excellence, par excellence in whatever we do. And so I moved on to attain my Bachelor's of Science in Nursing. And with a passion for public health, I obtained a Master of Science in Public Health from the University of London after attaining that Bachelor's from University of the West Indies. And along the way, I continued to work in critical care. I continued as well to be a nursing leader in Jamaica at University Hospital of the West Indies, managing many floors, I think about 8 floors at the time on the surgical block between the specialty block, where we call it ENT, orthopedics, and then the surgical wards, you know, burnt unit, you name it, at night. And that provided me with such rich leadership experiences that I now could take along the way to America, working in ICU, continuing to pursue my education. And then I thought, you know, I want to care for patients in an advanced way, use all this knowledge and skill to add to quality of care. And I thought the nurse practitioner role was optimal for that. I could now evaluate patients and come up with a plan of care for them, and also assist in health prevention and management. A lot of what we do as nurses is health prevention and management. That's a strong part of the nursing model that we bring that is different to the doctor's role. And so I did my nurse practitioner training at the University of Virginia School of Nursing. And I had such wonderful experience there. But I didn't stop there, always aiming for the best. I went on to the University of Colorado, where I did a wonderful hospitalist fellowship, which would prepare me to not just be a nurse practitioner as at the acute care level, but to also function adequately and optimally and confidently and competently in hospital, because our patient care has become so complex. And so having the skills and the knowledge as a nurse practitioner is vital to give the quality of care that patients expect from us and that we ought to deliver. All right, so where does the DNP come in? Yes, I did that at the University of Virginia as well. So nurses have gotten the wonderful opportunity to not only have a research-focused degree, but I can now say we have a practice-focused degree. So we can take all that knowledge that we have gained. We can not only focus on research, generating questions to better aim at quality care, but we can now deliver, transform all that research that we have gained over the years into making care better for our patients.
Wow, Dr. Reid, I sit and I watch you speak, and you have a passion for learning and a passion for nursing. And I'm gonna have to have you get you right up in the newspaper in Jamaica.
Sure, but it is a wonderful blessing, this career that we have been given, you know, as nurses to do what we do. And so I'm happy to care for patients. And not only that, I publish what I do in peer review publications, because I said quality important. So not only giving care, but publishing. How do we change policy as nurses, right? Nurses have been told what to do, but nurses should also be at the table to help to guide the care of patients. So research is also a part of my forte. And so I'm happy to be involved in that. And I mentor young nurses, new nurses, and I'm an instructor as well.
Okay, so you pretty much answered my next question, but I'm gonna ask it anyway. How has your expertise and education contributed to you being an integral part of the healthcare team?
Oh, so, you know, having been blessed with all this training that I've mentioned before and done all the lengthy training and studying, it has helped me to contribute to patient care in a pivotal way. I can be at the bedside and be the best clinician that I can be. I can collaborate with others. There are so many parts to the healthcare team. We work with physicians, occupational therapists, physical therapists, radiologists, you name it. And so I can bring my experience and training over the years at a doctoral level to guide care, ensure that evidence-based practice care is being delivered. For example, you have a patient with heart failure in front of you. Are we using the most recent guidelines to care for that patient? Are we ensuring that, okay, the patient is on the right medication for this present moment? A patient going to operating room, are we doing what is necessary to protect the patient from potential harms? Are we evaluating the patient and optimizing them for care? What does that mean? Simply, are we ensuring that the patient is getting the best care at this moment?
Thank you so much for that. I was speaking to someone recently, and that person was trying to get into medical school. The person was doing a program but wasn't doing so well. And he mentioned that, you know what, I probably should just go and do nursing instead. So I use my platform to bring public awareness to nursing, because a lot of people don't even know that nurses are so highly trained. They think that we just hand out medication at the bedside and bring coffee or tea to the patient or bathe patient. They don't understand that we are trained at this professional level, and we carry this expertise to the bedside and in the office of the outpatient provider to improve patients' life and to save lives, to promote longevity and to promote health across the board. How does your role differ from the doctors?
Great question. In the healthcare team, as said, we have many members, and the physician is one, and the nurse practitioner is one. And your friend, I'd advise to shadow with one of us nurse practitioners to begin to see all that we do. And even shadow with a nurse to see all that a nurse does, because it is more than just that, as stated. It is more than the bedpan, right? There's so much. And a big part of it is coordination of care. A nurse has to juggle many hats, right, in the coordination of the patient care. For my role, how is it different? As said before, I'm a registered nurse first and foremost, but I have advanced training. Altogether, many years, I'd say, may not be as many as a physician, but many years of training that has equipped me to care for patients and to carry out many of the similar roles as a physician. So I'm also able to assess patients, diagnose, treat. But how I would say differences are the nursing model that I bring. The nursing element is my strength. That enables me to build a relationship with patients, that bond. Not to say a physician and a patient don't have that type of relationship. However, nurses, as per studies out there, Gallup, for example, we have this trust with patients. We have been rated #1 year after year for years. We build this trust with patients. And so we're able to talk to them and answer their questions and educate them and go after the prevention aspect and maintaining their health. For example, I saw a patient just 2 nights ago coming in with heart failure. And this patient, I spoke to her, a physician is going to look at more so the diagnostic part of the care, get into what is the issue and diagnosing and treating. I want to get to the core, because I'm thinking, when this patient goes home, how do I prevent him or her from coming back? And in talking to the patient, I'm talking about your salt intake. How much water are you drinking? Because you have to ensure you're not drinking too much water as a patient with heart conditions. The patient was drinking about 7 liters of fluid, and they weren't weighing themselves. So at the end, I was able to talk to her daughter and educate them. You need to get a little scale, weigh yourself, and I told them what to do at discharge, how to start watching their weight, watching the fluid, talk about their kidney because the kidney was now being affected by the heart, and how to watch these things. And I think that is what a nurse practitioner brings to the table. They are able to bring that prevention and trust and build a relationship and talk to the patients and try to move the needle on their healthcare, right? And I think as we change to a doctoral level as well, we add an added layer to it, focusing on quality, shifting the needle on the quality of healthcare in our healthcare systems.
That is awesome, Dr. Reid. And you doctors and nurse practitioners, we have different scope of practice.
Right.
Different rules and different regulations.
Right, that too.
Exactly. And in the doctoral level as well, we are change agents, so we can identify certain things that's lacking in the healthcare system and implement programs that will help patients to advance, in terms of managing their health at home, because we can treat patients all we want in the hospital. They're not going to live in the hospital. We have to equip them fully to function at home to prevent readmission in the hospital.
Right, very pivotal. Or else it become a revolving door for the patient.
Exactly. What information would you give to the public that would be valuable in improving their health to prevent hospitalization?
Great question, Dr. Morgan. Once again, based on, I would say, the patient population that I care for, and I see, I'm in Florida, and so I see quite a number of elderly patients. So and on the spectrum, I also see younger populations. So I'm going to look at it from both perspectives based on who I'm seeing. For the elderly population, majority has to do with cardiovascular diseases coming in, or heart diseases. Also, we see our diabetes, right? So chronic medical conditions. And so I encourage persons, as I'm encouraging myself, to eat healthier and as organically as is possible. And what do I mean by that? If you can reduce, your chemical exposure, eating your fruits and vegetables, planting, having a backyard garden for yourself, depending on where you live. If you live in the city, as a friend of mine does, she plants in pots, on your lanai, your veranda, porch, or wherever is accessible to you, because it affects your health, right? Right. So eating healthier, reducing your fat intake if you can, and walk. Try to walk. I see Good Morning America doing this program on getting people to walk, and I'm going to join them. I too need to step it up. Instead of using the elevator, go up the stairs, walk more. And you don't have to attain that big lofty 10,000 goal. Just start moving so that you can get healthier. That means you're increasing your chance of living longer and healthier. So that's my older population. And if, as young folks do, you do these things, you're looking at prevention in the long run, right? Reducing your risk of heart diseases, strokes that I see coming in a lot these days. And then for the younger population, what I'm seeing plaguing us are substance uses, right? So not much what we call the lifestyle diseases as yet, but substance uses from exposure to drugs and alcohol. And at the core of it, it seems to be social isolation. I don't know, having gone through the pandemic, we have become more isolated from family or friends. And let us take the time to rebuild connections, rebuild friendships, get out there. Social media is important, but still take some time when you can to connect with others, to reduce that sense of social isolation. And if there are no friends or family, join groups in your communities, work groups. There are libraries out there. There are community health events. There are so many avenues out there. Volunteer. volunteer at food banks. You get to meet other people, you know, your community cleanup. There are so many things that are out there you can do to connect with others, to reduce that sense of social isolation, and seek counseling. And if you think you need help, reach out to someone, whether a pastor, a counselor, social worker, your hospitals, and the various lines that our national institutions have to reach out to get help.
That is so awesome. You have touched on some very, very valuable points. And what I'm getting is that a lifestyle change that is needed. I treat a lot of patients for obesity, and these patients, they're using the medication, but they're not making any change to their diet or their level of physical activity. They just want to see the weight gone by one injection. So you mentioned about changing the type of food that you eat and, you know, getting involved in certain activities. You also touched on a valuable point as well in terms of substance abuse in the younger population. We are losing a lot of young people who are taking, maybe they're smoking just marijuana that's laced with fentanyl.
Oh, yes, and unaware.
Oh my God, that is taking over the whole communities right now. So people need to be very careful, find program that will help you with smoke cessation, and that will help to eliminate, you know, cause of death from that point of view. But do you do any form of teaching? Because for me, I have a vast knowledge in nursing, and I'm giving back right now because I'm teaching advanced practice nurses, and I see you already as a professor. Are you teaching?
Thank you, Dr. Morgan. That's very wonderful of you to say. I do train new nurses in a nurse residency program. I'm happy to do that. It gives me a wealth of joy to give back to future nurses who, I remember when I just started out the first day at University Hospital, I said, Lord, please don't let me kill the patient. This June coming 19 years. And so I remember that fight, you know, I wanted to be the best nurse, but I was also fearful. And so I think it's my duty to pass down what I have learned. And instead of, as we say, eating our young, why not coach and mentor them? And so I'm happy to do that within that nurse residency program. And I also provide teaching opportunities at my alma mater, University of Virginia School of Nursing, when I can, in their Doctorate of Nursing Practice program.
That's awesome. That's awesome. So, you know, you are one of the pioneers in nursing right now, believe it or not. I do wish you get more exposure, and I do hope that for us who have traveled out of Jamaica and advanced our education, we'll find a way to give back and to help to build a better, stronger nursing community in Jamaica.
Oh, yes. Oh, yes. It is so thoughtful of you to mention that, because as you know, being an immigrant, our journey is quite an interesting and long one and arduous one at times. And I am happy to give back, especially recently, I should say, at the Nursing Research Day at University Hospital of the West Indies. And I'm happy to do that. And I encourage other nurses to give back when they can in their communities, to their alma mater, coach someone, mentor someone when they can.
Okay, thank you so much, Dr. Reid, for taking the time to share your wealth of knowledge on Health Talk. And I'm looking forward to see what's next on your agenda because the sky's the limit for you. Thank you so much. Do you have anything to add before we go?
Thank you for having me. And I thank my patients as well. And I thank my family, friends, and all those who have supported me along the way. And thanks again for having me, Dr. Morgan. It's been a pleasure.
Okay. This was Health Talk with Dr. Morgan and Dr. Reid. Thank you so much. Have a great day.